Welcome back to another episode at MedicMe, where in this episode we'll be talking about asthma. What is asthma? Asthma affects around 5.4 million people in the UK, and this is only counting those who are currently receiving treatment for asthma. This is around 8% of the current population, making asthma a very common lung condition. Therefore, we thought this would be an important topic to cover in MedicMe. Asthma is an inflammatory disease of the airways to the lungs. It makes breathing very difficult, and physical activities like jogging or running challenging or even impossible.
Normally, when you breathe, air is inhaled through your nose or mouth. It then goes down the trachea, through the bronchi, into the bronchioles, and eventually ends up in the alveoli, where gaseous exchange happens. However, for those who suffer from asthma, the lining of their airways swell, and the muscles that surround their bronchial tubes constrict, narrowing the air passages and making it extremely difficult to breathe. This reduces the amount of air that can get through to the alveoli each time asthma sufferers breathe. You can see the swollen lining of the airways on the image on the PowerPoint when compared to the normal lining. Furthermore, mucus produced by goblet cells that line the airways can also block these airways, further reducing the amount of air that passes through. You can also see how this excess mucus blocks the airway on the picture, and when paired with the swollen lining, it makes it hard for asthma sufferers to breathe. This is what causes asthma symptoms those with asthma suffer from.
What are the symptoms of asthma? The most common symptoms of asthma are wheezing, which is a high-pitched whistling sound made while breathing. Secondly, breathlessness, a tight chest, or coughing. Those with severe asthma may experience these symptoms most of the time. However, others may only experience these symptoms when brought about by certain triggers.
So, what are the triggers of asthma? Certain conditions and environments may also trigger the symptoms of asthma. The list of possible causes and triggers are extensive, and they include illnesses. For example, respiratory illnesses such as viruses, pneumonia, and the flu can trigger asthma attacks. Exercise, such as an increased movement, may make breathing more difficult. Next, we have irritants in the air, as people with asthma may be more sensitive to irritants, such as chemical fumes, strong odors, and smoke. Then we have allergens, such as animal dander, dust mites, and pollen, which may also trigger asthma. Extreme weather conditions can also trigger asthma, such as a very high humidity or low temperatures. And finally, emotions. When those with asthma express their emotions through shouting, laughing, and crying, it may trigger an asthma attack.
Types of asthma. Many people don't realize, but there are actually many different types of asthma. However, the most common type of asthma is bronchial asthma, which affects the bronchi. Other specific types of asthma are allergic asthma, which is also known as extrinsic asthma. Allergic asthma, also known as extrinsic asthma, is a common type of asthma caused by allergic reactions triggered by allergens. Examples of these kind of triggers can be mold, pollen, and dust. Allergic asthma is often seasonal, as it often goes hand in hand with seasonal allergies. An example is when extrinsic asthma is triggered by allergic reaction to pollen in summer. Non-allergic asthma is known as intrinsic asthma. It is a type of asthma that is triggered by irritants in the air which are not related to allergies. Examples of such irritants are burning wood, cigarette smoke, and air pollution. Occupational asthma is a type of asthma that is normally induced by triggers which are found at workplace. These include dust, dyes, gases and fumes, industrial chemicals, animal proteins, and rubber latex. These irritants can exist in a wide range of industries, including farming, textiles, woodworking, and manufacturing. Another type is exercise-induced bronchoconstriction. Exercise-induced bronchoconstriction, also known as EIB, usually affects people within a few minutes of starting exercise and up to 10 to 15 minutes after physical activity. Exercise-induced bronchoconstriction is very similar to asthma in the sense that it causes the airways to get tighter and narrower as a result of strenuous exercise. This condition is also sometimes referred to as exercise-induced asthma, but nowadays most call it EIB. Up to 90% of people with any type of asthma also experience EIB, but not everyone with EIB will have other types of asthma. Aspirin-induced asthma. Aspirin-induced asthma, AIA, also known as aspirin exacerbated respiratory disease, AERD, is usually a severe asthma condition. It's triggered by taking aspirin or other NSAID, such as naproxen or ibuprofen. The symptoms of aspirin-induced asthma may begin within minutes or hours after taking the NSAID, and the sufferers of this typical type of asthma typically have nasal polyps. Aspirin-induced asthma usually develops suddenly in adults between the ages of 20 and 50. Nocturnal asthma. Nocturnal asthma is a type of asthma where the asthma symptoms the sufferer experiences worsens at night. The trigger for this type of asthma, which are thought to bring on these worsened symptoms at night, include heartburn, pet dander, and dust mites. The body's natural sleep cycle may also trigger nocturnal asthma. And finally, cough variant asthma, CVA. It doesn't have the classic asthma symptoms of wheezing and shortness of breath, but it's characterized by persistent dry cough. If it's not treated, CVA can lead to full-blown asthma flares that include the other more common symptoms.
Exacerbations. When your asthma symptoms get progressively worse, it is known as an exacerbation or an asthma attack. If this occurs, it becomes increasingly difficult to breathe. This is because your airways are swollen and your bronchial tubes have narrowed. The symptoms of an exacerbation include hyperventilation, breathing that can leave you feeling breathless, coughing, wheezing, shortness of breath, increased heart rate, and agitation. Although an exacerbation can end quickly without medication, it affects your ability to breathe and can quickly become life-threatening. The longer an exacerbation continues, the more it can affect your ability to breathe. This is why those with a severe asthma often require a trip to the emergency room every time they experience an exacerbation. However, exacerbations can be prevented by taking medications that help manage your asthma symptoms.
Diagnosis. There are three main tests that are used to help diagnose asthma, which are FeNO, fractional exhaled nitric oxide test. In this test, you breathe into a machine that measures the level of nitric oxide in your breath. If a high level of nitric oxide was detected in your breath, it is a sign that you have asthma. This is because nitric oxide is produced by your body to relax muscles and combat inflammation. Therefore, high levels of exhaled nitric oxide in your breath indicates inflamed lungs and hence asthma. Next is spirometry. This is a test where you blow into a machine that measures how fast you can breathe out and how much air you can hold in your lungs. Those who have asthma typically are shown to breathe out slower but contain the same amount of air in their lungs by the spirometry test. Finally, the peak flow test. This is a test where you blow into a handheld device that also measures how fast you can breathe out. For diagnosing conditions like asthma, the test may be done several times over a few weeks to see if the speed of breathing out changes. Those with asthma typically have a slower speed of breathing out. After you're diagnosed with asthma, you may also have allergy tests to see if your symptoms might be triggered by any allergies. Therefore, these allergy tests mainly identifies whether the type of asthma the person suffers from is extrinsic asthma or not.
Chronic obstructive pulmonary disease, also known as COPD, and asthma are commonly mistaken for one another. This is because they have similar symptoms, including wheezing, coughing, and trouble with breathing. However, the two conditions are quite different. COPD is an umbrella term used to identify a group of progressive respiratory diseases. These include, for example, chronic bronchitis and emphysema. Similar to asthma, COPDs cause reduced airflow due to inflammation in the airways. The condition may also worsen over time. The difference between asthma and COPD is that asthma can occur at any age, with a majority of diagnoses coming in childhood. On the other hand, most people with COPD are at least the age of 45 at the time of their diagnosis. Furthermore, asthma can get better with medication and a personal asthma action plan. Symptoms can come and go, and you may be symptom-free for a long time. On the other hand, with COPD, symptoms are constant and get worse over time, even with treatment. It's not clear what causes asthma besides genetics, but asthma attacks are often the result of exposure to triggers such as physical activity or smells. These triggers can make breathing problems worse. On the other hand, the most common cause of COPD is smoking. In fact, smoking accounts for up to 9 out of 10 COPD-related deaths.
Prevention. Because researchers haven't been able to identify the exact cause of asthma so far, it's challenging to know how to prevent the inflammatory condition. However, more information is known about preventing asthma attacks. These strategies include avoiding triggers such as steering clear of chemicals, smells, or products that caused breathing problems in the past. Secondly, reducing exposure to allergens such as dust or mold that may trigger an asthma attack. Next, getting allergy shots. For example, getting treated with allergen immunotherapy that helps alter the immune system by making it less sensitive to any triggers you encounter. And finally, taking preventative medication. The doctor may prescribe medications for asthma sufferers to take on a daily basis. This medication may be used in addition to the medications asthma sufferers use in case of an emergency.
Management. Those with severe asthma also have to make changes to their lifestyle in order to reduce the risk of going into an asthma attack. These lifestyle changes include eating a healthier diet, as this helps improve your overall health as a whole, maintaining a healthy weight, as asthma tends to be worse in people who are overweight and obese, quitting smoking, as irritants such as cigarette smoke can trigger asthma and increase your risk for COPD as well, exercising regularly, as even though physical activity can trigger an asthma attack, regular exercise may actually help reduce the risk of breathing problems. Managing stress, because stress can be a trigger for asthma symptoms. It can also make stopping an asthma attack more difficult.
Thank you for watching this episode of MedicMe. Make sure to check out all our socials in the description down below, as well as a blog page where we release different articles every week. Thank you for watching.